Okay, my name is Ken Bohannon, and I'm going online for a discussion with you in reference to the condition I have as a result of a hip prosthesis operation. And if you go online and you check out hip prosthesis procedures and so forth, you'll see that most of the sites that will come up are featuring law groups or lawyers discussing lawsuits related to hip procedures and hip operations and the conditions which accompany them. And so I thought, as a person who has undergone surgery and spent the last 2.5 years really taking a look at it, I thought I would go online and help you out so that the same mistakes aren't made in your case, so that you look very closely to what you're about to enter into when it comes to hip surgery or knee surgery or practically any other surgery. But again, let's focus on hip surgery. I had a hip prosthesis change out as a result of over a 5-year period of deterioration of my hip, and a lot of pain associated with it. So I underwent hip arthroplasty, and then subsequently that didn't work out, and then I decided that after 2 years I would replace the whole hip. So I want to talk to you about the complications of what can happen if you don't go about studying and understanding what you're about to get into when it comes around to a hip change out or a knee change out or whatever you're going to have changed out. So in my case, I have what is called the metallosis, which is a metal poisoning. And the particular metal poisoning I have is related to the trunnion or connector between the femoral stem and the connector or trunnion going into the ball, which fits into the acetabular column. So I have cobalt particular ions from the deterioration of the trunnion. So this is called trunnionosis. And so I want you to understand when you hear about the word trunnionosis that it rings a bell, or when you hear about metallosis. So there are certain things that you can do to prevent this right up front. Make sure that when you go to visit your doctor that you inquire as to what you're allergic to. So you should undergo maybe a metals test to a simple blood test to determine what kind of metals that you might be allergic to. Obviously, if you have a problem with cobalt or chromium, you might want to look at titanium. Or if you have a allergy to any of these metals, you want to look at ceramic prosthesis. At any rate, so that's the important thing to consider. Know your prosthesis manufacturer. Some manufacturers have multiple lawsuits because of failures with their prosthesis. And visit online sites, as many as you can, study them, know about your procedure, know about what you're about to undertake, and then make a note, archive everything you do. And don't take anything for granted. I mean, it's your life, you know, tune into what you're about to enter into. So I think at this point I'm going to sign off. I did want to give you an introduction to this. You can check me out on YouTube, and I'll have more details on YouTube related to trunnionosis and metallosis and what is called alval, or the alval is a condition where your lymphatic system obviously is attacked because you have the cobalt ions entering into your lymphatic system. They enter into the soft tissue, cause pseudotumors and lesions around your prosthesis and so forth. But I'm going to sign off right now, and then I'll continue this in another video, so check this out on YouTube. This is Ken Bohannon on metallosis and trunnionosis related to hip prosthesis. Thank you.